Good day. I'm Dr. Cheryl Wesen. I'm the Medical Director of the Ascension St. John Breast Program. I'm thrilled to be with you today. I'd like to talk with you a little bit about screening for breast cancer and high-risk surveillance. There's a lot of misinformation out there and confusion about what screening involves and who should get screened. More than 280,000 women each year in this country are diagnosed with breast cancer. And really the good news is that there are more than 4 million survivors of breast cancer. So the purpose of screening is to identify a breast cancer that may be developing at the earliest possible stage so that treatment can occur and women will survive their breast cancer. The earlier the breast cancer is identified, if one is there, the fewer the treatments are required and the easier the treatment is, and the better the survival. Most women in particular, overestimate their risk of breast cancer. And there is significant risk of breast cancer, but for women in this country, the risk of heart disease is much higher than breast cancer. That being said, we still want to identify the breast cancer as soon as we possibly can and to get it at the earliest, smallest stage. The guidelines for screening for breast cancer, which I like to utilize, are from the National Cancer Consortium, and they involve a woman having a clinical breast exam by a practitioner every 1 to 3 years from ages 25 to 39. At age 40, an annual mammogram should be performed. And nowadays we have mammograms that are called 3D or tomosynthesis. Those are specialized mammograms that take photographs of the breast that are smaller pieces and easier for the radiologist to interpret. It doesn't involve any more discomfort or change in the mammogram to have the 3D mammogram, and we have been identifying abnormalities in the breast at an earlier stage. In addition, it's important for a woman to be aware of her breasts and to notice any changes that may occur. Some people wonder how long they should be getting mammograms, and we recommend that the annual mammogram be performed every year until a woman has medical issues or is getting older, so that one would estimate that she might not live more than 10 more years. Because in this country women are living longer and longer, that could be a woman who's in their 80s or even in their early 90s when they no longer need to have mammograms performed. There are some people that have a higher than average risk, and we recommend doing more surveillance than just the annual mammogram. That risk spectrum is fairly wide. Some people have genetic mutations that put them at extraordinary risk of developing breast cancer. And for those women, we sometimes even recommend prophylactic surgery to decrease their risk. Other women have dense breast tissue, or they've had biopsies that have shown atypical cells, and so they're at higher risk than an average woman of developing breast cancer. In addition to the self-examination and a clinical breast exam, as well as annual mammograms, those women that are at higher than average risk may start getting mammograms at a younger age, not before age 30, but it could be 10 years younger than the family history of the youngest person in their family with breast cancer. And in addition to mammograms, we sometimes recommend automated whole breast ultrasound, which are ultrasounds of both breasts that look at the entire breast tissue and are able to identify things that we don't see on every mammogram. The very highest sensitive test that we have is a breast MRI, and only a few people really are candidates for breast MRI. It does involve a little bit longer test, 35 or 45 minutes to get a breast MRI, and an IV needs to be started and a dye needs to be administered in order to have a breast MRI. So the breast MRIs are reserved for the highest risk person that we want to identify a breast cancer at the earliest possible stage. We have learned so much, and the technology regarding screening is so much higher that we've really made tremendous strides in the treatment of breast cancer. One thing that I do want to recommend is the thermogram, which some people think would be preferable to a mammogram because it doesn't have radiation, has never been shown to be as accurate as a mammogram. And so I don't recommend thermograms for anyone who is trying to screen for breast cancer. We've talked a lot about what the imaging can do for identifying early breast cancer, and we can't really change our family history or our genetics. That's not something that's under our power. But there are some lifestyle changes that are under our power that can decrease our risk of developing breast cancer. One of the best lifestyle modifications is to have exercise. Daily exercise of whatever nature, whether it's walking or jogging or swimming, bike riding, decreases the risk of breast cancer. So there's substantial benefit to having daily exercise. It's also important that we maintain our weight in a normal range, especially in the postmenopausal years, because fat cells produce estrogen, and estrogen can help fertilize breast cancer cells and help them grow. So we want to decrease the amount of estrogen that circulates in our body when we are postmenopausal, and weight loss to a normal weight is helpful in that regard. Similarly, moderation and even decreased amount of alcohol in our diet is an important consideration. Women should try to have less than 1 drink a day, and even less alcohol than that can be beneficial in terms of decreasing the risk of breast cancer. We know also that vitamin D is an important component, and it's important to know what your vitamin D levels are and to take supplements if your vitamin D levels are not high enough. An excellent diet that is low in saturated fat and red meats can be helpful, and these things are under our control. Things that are a little bit less easily controlled are the age that we have our first live birth. The younger is beneficial in terms of risk of breast cancer, and breastfeeding when we do have our children. So there's many things that we can modify, and importantly is to be aware of our body, to make sure that we get the screening that's recommended, that's appropriate for us in our risk situation, and to understand that there are things that we can do to help decrease our risk of breast cancer. So hopefully this is helpful hints for you, and thank you very much.